10 symptoms of poor heart circulation. Dorothy is 80 years old. Every single morning, the moment she gets out of bed, the room tilts just for a second or two and everything goes slightly gray at the edges. She never told her doctor. She never told her children. She just quietly built it into her morning routine, the same way she builds in making coffee or feeding her cat, because she assumed it was simply what happens when you get older. It took a direct question from her physician, years later, to find out that this small, private habit was actually one of the clearest signals her body had been sending her the entire time. If you are watching this and thinking, that sounds a little familiar, stay with us, because Dorothy's story is not rare. Research suggests that a large share of people living with reduced heart circulation go months, sometimes years, without recognizing the signs, simply because those signs rarely look the way we expect them to. Most of us believe poor circulation only shows up as cold hands or tingling feet. That belief is incomplete, and in some cases it can be dangerously misleading, because several of the earliest warning signs have nothing to do with temperature at all. Some show up in your gums. Some show up in your vision. And one of them, the one Dorothy lived with silently for years, can show up while you are simply standing up from a chair. Before we go any further, a quick note. This video is for educational purposes only. It is not intended to diagnose any medical condition, and it should never replace a conversation with a qualified healthcare professional. If anything in this video sounds familiar to you or to someone you love, the most helpful next step is simply to bring it up with a doctor, rather than trying to interpret it alone, the way Dorothy did for far too long. Circulation problems tend to build slowly, almost quietly, which is part of what makes them so easy to miss. The heart is a pump, and blood vessels are the highways that carry oxygen and nutrients to every part of the body. When that system starts to narrow or weaken, the body does not usually send one loud alarm. Instead, it sends small, scattered signals, and those signals can show up in places you would never expect to look, from the color of your skin to the clarity of your thinking on an ordinary afternoon. What makes this especially tricky is that each of these signals taken by itself can be explained away by something harmless. A little dizziness, a bit of extra fatigue, hands that feel cool in an air-conditioned room. None of these prove anything on their own. But when several start to overlap, or when one of them becomes a fixture of daily life rather than an occasional inconvenience, that pattern is worth paying attention to, the same pattern that quietly followed Dorothy for years before anyone connected the dots. We will return to her story before this video ends, because what her doctor discovered changed how she thought about a habit she had stopped even noticing. But first, let's start with the signs that tend to appear earliest, the ones that often show up long before anything feels seriously wrong. Number 1, cold hands and feet that do not warm up easily. Everyone gets cold hands once in a while, especially in winter. But there is a difference between hands that warm up after a few minutes indoors and hands that stay cold no matter what you do, no matter how many layers you add or how close you sit to a heater. When circulation to the small blood vessels in the fingers and toes is reduced, those areas may receive less warm, oxygen-rich blood than the rest of the body, and that can leave them feeling persistently cool, sometimes even taking on a slightly pale or bluish tint that seems to come and go without warning. Margaret, a 71-year-old retired schoolteacher, mentioned to her daughter that her hands had felt cold for months, even while she was cooking dinner over a hot stove. She assumed it was simply a normal part of getting older, something she had heard other women her age mention in passing. It was only after a routine checkup, where her doctor asked a few extra questions about her circulation, that she learned this symptom was worth paying closer attention to. Stories like hers are common, because this sign is so easy to explain away, and so easy to fold quietly into the background of daily life. This does not mean that everyone with cold hands has a heart condition. Many things can cause cold extremities, including simple sensitivity to temperature, low body weight, or spending too much time in air conditioning. But when the coldness is constant, one-sided, or paired with other symptoms on this list, it may be worth discussing with a healthcare professional, since it could be associated with how efficiently blood is circulating through the body, particularly to its farthest and smallest vessels. One detail worth noticing is whether the coldness affects both hands equally, or whether one side seems noticeably different from the other. A consistent difference between the left and right side of the body is sometimes considered more significant than an overall feeling of coolness, because it may point more directly toward a localized circulation issue rather than a general sensitivity to temperature. Number 2, swelling in the legs, ankles, or feet. Swelling, also known as edema, happens when fluid builds up in the tissues of the body. When the heart is not pumping as efficiently as it should, blood can back up in the veins, particularly in the lower body. Because gravity makes the legs and feet the first place fluid tends to accumulate over the course of a day. This can leave the skin looking puffy, feeling tight, or showing a slight indentation when pressed, an indentation that can take several seconds to fade back to normal. This kind of swelling often gets worse throughout the day, especially after standing or sitting for long periods, and it may improve somewhat overnight while lying down, only to return again by the following afternoon. Some people notice that their socks leave a deeper mark than usual, or that their shoes suddenly feel snug even though nothing else about their routine has changed. No new pair, no change in diet, nothing they can immediately point to. It is worth noting that swelling can come from many sources, including diet, medication, or simply sitting too long on a flight or during a long car ride. However, when swelling becomes a regular pattern, especially alongside shortness of breath or fatigue, it may be associated with how well the heart is managing blood flow. And that combination is one many healthcare providers pay close attention to during a physical examination. There is also a practical detail worth mentioning here. Weighing yourself at roughly the same time each day and noticing sudden jumps of a few pounds within a short window can sometimes reflect fluid retention rather than changes in eating habits. This is not something to self-diagnose from, but it is the kind of detail that can be genuinely useful information to share with a doctor if swelling becomes a recurring concern. Number 3, unusual fatigue that does not match your activity level. There is ordinary tiredness, the kind that comes after a long day or a poor night of sleep. Then there is a different kind of fatigue, one that shows up even after rest, even after a full night in bed, even during activities that used to feel completely effortless. When the heart struggles to circulate enough oxygen-rich blood to the muscles and organs, the entire body can feel like it is working harder just to keep up with daily life, as though every task now carries an invisible extra weight. Robert, a 68-year-old retired mechanic, described it to his son as feeling like he was walking through waist-deep water, even on flat ground. He had always been the kind of man who mowed his own lawn without stopping, who prided himself on never needing help with physical chores. When that same task started leaving him winded and drained, he initially blamed it on age, telling himself that everyone slows down eventually. It turned out to be a signal worth investigating further, one that had been building quietly for months before he mentioned it to anyone. This kind of fatigue is easy to dismiss because tiredness is such a universal human experience. Almost everyone feels tired sometimes, which makes it easy to assume that any new fatigue must have an ordinary explanation. The distinguishing detail is the mismatch, feeling exhausted from tasks that once felt simple without a clear explanation like poor sleep, stress, or illness. When that pattern persists for more than a few weeks, it may be helpful to mention it to a doctor, since persistent, unexplained fatigue can sometimes be connected to circulation, particularly when the heart is not delivering oxygen as efficiently as it once did. It can also help to notice whether the fatigue follows a pattern tied to specific activities, such as climbing stairs or carrying groceries, rather than appearing randomly throughout the day. A fatigue that consistently shows up with physical exertion and improves with rest tends to carry different meaning than a general low-grade tiredness that lingers all day regardless of activity. Number 4, shortness of breath during light activity. Breathlessness after a sprint or a steep hill makes sense to almost anyone. Breathlessness after walking to the mailbox or climbing a single flight of stairs is a different story entirely, and often a more concerning one. When circulation is compromised, the lungs may not receive enough oxygenated blood flow to keep up with even modest physical demands, and fluid can also build up around the lungs in some cases, making each breath feel shallower and less satisfying than it used to. Some people describe this sensation as needing to take a breath before they finish a sentence, or waking up at night feeling like they cannot get enough air unless they prop themselves up with an extra pillow, a habit some people adopt without even realizing why they started doing it. These details matter, because they help distinguish ordinary breathlessness from something that may be tied to how the heart and lungs are working together, and how efficiently that partnership is functioning. As always, there are many possible explanations for shortness of breath, including allergies, anxiety, being out of shape, or simply the effects of a recent cold. But when it appears suddenly, worsens over time, or shows up during activities that never used to cause it, such as making a bed or carrying a small bag of groceries up a short flight of stairs, it may be worth exploring with a healthcare professional, since it could be one of the ways the body signals that circulation needs attention before the situation progresses further. A useful way to track this at home, purely for the purpose of having a clearer conversation with a doctor, is to notice whether breathlessness happens at rest, with mild activity, or only with strenuous activity, and whether that threshold seems to be shifting over time. Doctors often find this kind of timeline genuinely helpful when trying to understand how a symptom has developed. Number 5. Numbness or tingling in the hands and feet. A pins and needles sensation after sitting cross-legged for too long is familiar to almost everyone, and usually nothing to think twice about. But numbness or tingling that appears without an obvious cause, especially if it lingers or returns frequently throughout the week, may point to something else. When blood flow to the nerves in the hands and feet is reduced, those nerves may not receive the oxygen they need to function normally, which can create sensations ranging from mild tingling to a duller, harder-to-describe numbness that some people struggle to put into words. This sign often overlaps with the cold hands and feet mentioned earlier, and the two together can paint a more complete picture than either one alone. Some people also notice that their nails grow more slowly, or that small cuts on the fingers and toes take longer to heal, both of which can be connected to how well blood is reaching those areas, since new tissue and healthy nail growth both depend on a steady, reliable blood supply. Diabetes, vitamin deficiencies, and nerve compression from things like carpal tunnel syndrome can all cause similar sensations, so this symptom on its own is not a definitive signal of anything in particular. Still, when it appears alongside other items on this list, especially the cold extremities and slow healing mentioned elsewhere in this video, it may be worth raising with a doctor, since persistent numbness can sometimes be associated with reduced circulation to the extremities. It is also worth mentioning that the pattern of numbness matters. Tingling that affects both feet in a similar symmetrical way can have different underlying causes than numbness that affects only one hand or one foot, and a doctor examining these symptoms will often ask specifically about that distinction as part of forming a clearer picture. Number 6. Skin changes, including discoloration and slow healing wounds. The skin is often the first place to visibly reflect what is happening beneath the surface, long before a person feels unwell in any other way. When circulation slows down, the skin on the legs and feet may take on a bluish, purplish, or unusually pale tone, particularly around the ankles, and this discoloration can sometimes be more noticeable after standing for a while. Some people also notice that the skin becomes shinier, thinner, or loses hair in patches, especially on the lower legs, because hair follicles rely on a steady blood supply to function properly. And when that supply falters, hair growth is often one of the first things to slow down. Wound healing is another area worth watching closely. A small cut or scrape that used to heal within a week might now take several weeks, or might not seem to heal at all, staying open and tender far longer than expected. This happens because new tissue formation depends heavily on a fresh supply of oxygen and nutrients delivered through the bloodstream, and when that delivery system is compromised, repair slows down accordingly, sometimes dramatically so. Linda, a 64-year-old grandmother, noticed a small scrape on her shin from bumping into a coffee table while babysitting her grandchildren. Weeks later, it still had not closed properly, and had actually started to look slightly more irritated rather than less. She almost dismissed it as simply being clumsy and impatient, telling herself she just needed to leave it alone longer. But her doctor recognized it as a pattern worth investigating further during her next visit. Slow-healing skin changes like these can sometimes be one of the more visible clues that circulation deserves a closer look, precisely because they are so easy to see and yet so easy to underestimate. A practical detail worth keeping in mind is timing. Most minor scrapes on healthy skin show visible improvement within roughly 1 to 2 weeks. When healing consistently takes noticeably longer than that, without any obvious reason such as diabetes or infection already being managed, it is a reasonable detail to mention at a medical appointment, even if it feels minor. Number 7. Chest discomfort that comes and goes with activity. Chest discomfort is one of the more well-known warning signs, but it does not always show up the way people expect. And that mismatch between expectation and reality is exactly why it gets missed so often. Instead of a dramatic, crushing pain, many people describe a tightness, a pressure, or a heaviness that appears during physical activity or emotional stress and eases with rest, sometimes fading within just a few minutes of sitting down. This pattern, sometimes called angina, happens when the heart muscle itself is not receiving enough oxygen-rich blood to meet its demands in the moment, particularly during exertion when the heart needs to work harder. This sensation can sometimes be mistaken for indigestion or muscle strain, which is part of why it is so often overlooked or explained away with a home remedy or an antacid. The detail that tends to matter most is the pattern. Discomfort that reliably appears with exertion, such as climbing stairs or walking briskly, and reliably fades with rest, suggests a connection to how blood is reaching the heart, rather than a random, one-time occurrence tied to something eaten earlier in the day. It is important to say clearly that any new or unexplained chest discomfort should be evaluated by a medical professional promptly, since chest symptoms can range from minor to serious, and only a proper evaluation, often involving simple tests, can tell the difference with any real confidence. This is not a symptom to guess about at home, and it is not one to wait out for weeks hoping it resolves on its own. Some people also notice that this discomfort can radiate outward, spreading toward the shoulder, arm, jaw, or back, rather than staying confined to one small spot on the chest. This spreading quality is another detail that healthcare professionals often ask about specifically, because it can help distinguish cardiac-related discomfort from more localized muscular pain. Number 8. Cognitive fog, memory lapses, and difficulty concentrating. The brain uses a remarkably large share of the body's oxygen supply relative to its size, which makes it especially sensitive to even small changes in blood flow. When circulation to the brain is reduced, even slightly, some people notice a kind of mental fog, difficulty concentrating, forgetting words mid-sentence, or feeling mentally slower than usual, even though nothing about their daily routine has changed, no new stress, no change in sleep, nothing they can point to as an obvious cause. This sign is one of the easiest to attribute to something else entirely, whether that is stress, poor sleep, or simply getting older, and in fairness, those explanations are correct far more often than not. Frank, a 73-year-old retired accountant who had done mental arithmetic his entire career, began noticing that he had to write things down that he used to remember effortlessly, small things like phone numbers or grocery lists that had never given him trouble before. He assumed it was a normal part of aging, and in many cases that assumption would be correct. But it is also one of the reasons this symptom deserves a mention here, because when it appears alongside other circulation-related signs, it may be worth discussing with a healthcare provider rather than assuming it away entirely. To be clear, memory changes have an enormous number of possible causes, and most of them have nothing to do with the heart. This sign should never be interpreted on its own as evidence of a circulation problem, and doing so would be misleading and unhelpful. It is included here because, in combination with other symptoms on this list, it may add useful context for a healthcare professional to consider when trying to understand the full picture of what someone is experiencing. Something else worth noting is the difference between occasional forgetfulness, which is a normal part of being human at any age, and a more consistent, noticeable shift in mental clarity that a person's family or close friends start to comment on. That kind of outside observation, from someone who knows a person well, can sometimes catch a gradual change before the person experiencing it fully recognizes it themselves. Number 9. A rapid, irregular, or noticeably strong heartbeat. Most of the time, a healthy heartbeat goes completely unnoticed, quietly doing its job in the background without ever calling attention to itself. When circulation becomes strained, some people become newly aware of their own heartbeat, describing it as fluttering, skipping, racing, or pounding, sometimes even while sitting still, watching television, or lying in bed at night trying to fall asleep. This can happen because the heart may attempt to compensate for reduced blood flow by working harder or beating differently than usual, essentially trying to make up for inefficiency with extra effort. This sensation, sometimes called palpitations, does not automatically indicate a serious problem, since caffeine, stress, dehydration, and many harmless factors can also cause it, and most people experience an occasional flutter at some point without it meaning anything significant. What tends to matter more is frequency and context. A fluttering feeling that shows up occasionally after a stressful meeting or too much coffee is different from one that recurs often, lasts for extended periods, or is accompanied by dizziness, chest discomfort, or shortness of breath happening at the same time. If an irregular or unusually strong heartbeat becomes a repeated experience rather than an occasional one, it may be helpful to have it evaluated, since the heart's rhythm can offer meaningful clues about how well it is circulating blood throughout the body, and a simple test can often clarify what is happening far more reliably than guessing. Keeping a brief, informal note of when these episodes happen, what a person was doing beforehand, and how long each one lasted can be genuinely useful information to bring to a doctor's appointment, since palpitations often do not happen conveniently during an office visit, and a clear personal record can help fill in that gap. Number 10, dizziness or lightheadedness, especially when standing up. Now we come back to Dorothy and the sign we opened with. When circulation is compromised, the body may struggle to adjust blood flow quickly enough when changing position, particularly when moving from sitting or lying down to standing, and this can create a brief but noticeable wave of dizziness, lightheadedness, or even a momentary sense of the room tilting or going slightly gray at the edges, exactly the way Dorothy described it once she finally put it into words. What makes this sign especially worth understanding is how often it gets normalized, tucked away as simply a quirk rather than a signal. Many people and many families assume that a little dizziness upon standing is simply an unavoidable part of getting older, something to laugh off and move past. In some cases, that may be true. But healthcare professionals often view this symptom as a meaningful data point precisely because it reflects, in real time, how efficiently the cardiovascular system is responding to a change in demand, almost like a live readout of how well the whole system is working together. It was only during a routine visit, when her physician asked directly whether she ever felt lightheaded upon standing, that Dorothy's symptom finally came up, almost as an afterthought, something she nearly didn't mention at all. Her story is a reminder that some of the most telling signs are the ones we quietly learn to live with, rather than the ones that announce themselves loudly, and that a single direct question from a doctor can sometimes surface something a person has been carrying silently for years. It is worth mentioning that dizziness upon standing can sometimes be accompanied by a brief moment where vision dims or narrows before returning to normal within a few seconds. When these episodes become frequent, or when they are ever severe enough to cause a fall or near fall, that is a detail worth sharing with a doctor without delay, since it moves from a minor observation to something meriting timely attention. 10 signs, and yet the common thread running through all of them is simple. Circulation problems rarely announce themselves with a single dramatic moment. Instead, they tend to whisper through small, easy-to-dismiss changes, cold hands that never quite warm up, a scrape that heals a little too slowly, a dizzy spell that has become part of the morning routine, the way it became part of Dorothy's. According to cardiovascular researchers, poor circulation contributes to complications in a substantial portion of heart-related conditions worldwide, which is exactly why recognizing these early, quiet signals matters so much, long before they have a chance to become something more serious. None of these symptoms on their own confirms a diagnosis. The body is complicated, and many of these signs have entirely harmless explanations that have nothing to do with the heart at all. But when several of them show up together, or when any one of them becomes persistent and unexplained, that combination is worth bringing to a healthcare professional, not as a cause for alarm, but as a reasonable, proactive step toward understanding what your body may be trying to tell you, in its own quiet, unhurried way. If someone in your life, a parent, a grandparent, or even you, has quietly been living with one or two of these signs, treating them as simply part of getting older, this might be a good moment to ask a few more questions, either to a doctor or simply to that person. Sometimes the most important conversations start with something as small as, does your heart ever feel like it is racing for no reason? Or do your feet still get cold even indoors? And those small questions can open the door to a much more useful conversation with a medical professional down the line, just as one question finally opened the door for Dorothy. It is also worth remembering that awareness itself is not meant to create fear. The goal of a video like this one is not to send anyone into worry over every cold morning or every moment of forgetfulness. It is simply to offer a clearer map of what circulation-related symptoms can look like, so that if a genuine pattern does emerge, it gets noticed sooner rather than later, and addressed with the guidance of someone qualified to interpret it properly. We would love to hear your thoughts. Have you or someone close to you experienced any of these signs before receiving an explanation for them, the way Dorothy did? Share your experience in the comments below. It might help someone else recognize a pattern in their own life that they had not thought to connect until now. If you found this video helpful, consider sharing it with someone who might benefit from it. Perhaps a parent, a grandparent, or a friend who has been brushing off a symptom of their own. And if you would like more educational content like this, subscribing helps us keep making it. Thank you for watching and take care of that heart of yours.